hand.
Yes.
And note that the patient gave consent. So the first thing that we're going to find is I'm going to find the styloid process of the radius. So I'm going to find the shaft of the radius, and I'm going to move my way down till I feel a bony prominence here on the end. Same thing with the ulna. I'm going to move down the shaft of the ulna, and then till I find the bony prominence right there. And so here is the styloid process of the ulna and the radius. And to find the Lister's tubercle, I'm going to move from the styloid process of the radius over dorsally until I feel a bony prominence right here. And I can even ask the patient to extend their index finger. And will you extend your index finger? And I can feel an extensor pollicis muscle contracting. Okay, you can relax your hand. And so the next thing we'll find is the radial artery. So I'm going to have to turn the patient's hand over, and here's the radial styloid process. I'm going to move ventral to that, and then I can find the radial artery. And to find the ulnar artery, I'm going to start from the styloid process of the ulna, and then I'm going to move ventral and past the flexor carpi ulnaris, and you just have to feel a little bit more deeper. It's not as prominent as the radial artery. And I feel it. And then just right below the distal to the styloid process, the ulna, the next bony prominence is the pisiform bone. And if I have an imaginary line from the pisiform bone to the second MCP joint, I can go about a ½ inch, and I can find a bony prominence right here, which is the hook of the hamate. Okay, and then I'll turn the patient's hand over. I can find the Lister's tubercle again from the styloid process to Lister's tubercle, and from Lister's tubercle I'm going to move down to the end of the radius until there's a divot, and then I'll have the patient turn their hand down, and I can feel the lunate carpal bone go into my thumb, and then I can move down from the lunate to the next bony prominence, the capitate. And then to find the triquetrum, I'm going to go from the styloid process of the ulna down to the divot, and then I'm going to have the patient turn his hand to the left, and then I can feel the triquetrum carpal bone pop into my middle